The Department of Medical Assistance Services would like to welcome you to the September 2022 Consumer Directed Services Quarterly Update. Our goal is to provide updated information for CD personal care attendants that provide services to Medicaid members. We encourage each attendant and employer of record, or EOR, to review this quarterly information to help support their role in the CD program. This training will discuss a Department of Medical Assistance Services, or DMAS, overview, consumer-directed, or CD, services, roles and responsibilities, abuse, neglect, and exploitation, fraud, waste, and abuse, EVV time entry and submission, paid sick leave information, attendant proof of address requirement, and CD resources. DMAS provides insurance to 1 out of 5 Virginians. As an attendant, you may now be eligible for Medicaid coverage due to recent changes to income limits for the Cover Virginia criteria. Additional Medicaid information may be found at the Cover Virginia website and in the Waiver and Program Services section on the DMAS website. There you will discover topics like Developmental Disability or DD waivers, Commonwealth Coordinated Care or CCC Plus waiver, and the Early and Periodic Screening, Diagnostic, and Treatment or EPSDT program. Medicaid waiver benefits include consumer-directed services. These are support services that are necessary to enable an individual to remain at or return home rather than enter an institution. This service model empowers the member receiving services to employ an attendant to provide care. Let's review some frequently used terms. Employer of record, or EOR. This person performs the function of the employer in the consumer-directed model. The EOR may be the individual receiving the services or another person designated by the individual. Individual or member. This person is receiving Medicaid waiver services and support. Personal care attendant, or PCA, or attendant. The person hired to provide consumer-directed care or supports. Services facilitator, or SF. This is the provider that is responsible for assisting the individual or EOR with the employer packet, hiring of an attendant, and coordination of other CD-related services. Fiscal employer agent, or FEA. These are contractors that handle attendant payments for CD services on behalf of the EOR. Currently, there are 3 FEA contractors working with the consumer-directed services population. There are 3 available services in the CD program: attendant care, which is also known as personal care, respite care, and companion care. Please note, CD attendants may not perform skilled respite services. Skilled respite can only be provided by a registered nurse or a licensed practical nurse. Attendants often ask who their employer is. The employer record, or EOR, has this responsibility. Each individual receiving CD services must have an EOR. This person may be the Medicaid member or a designated representative. This person is also considered the employer of the attendants providing care and supports for the individual. An EOR must be at least 18 years old. DMAS, the SF, and the FEA do not employ the attendant. The EOR employs the attendants. Here are some duties of the EOR: recruiting, interviewing, hiring, training, directing, and supervising all attendants, firing an attendant if necessary, making schedules and tasks to be completed by each attendant, managing and evaluating the work of each attendant, keeping track of the services provided, and establishing a system for signing and submitting shifts worked. If you have questions about hours or training, your EOR is the best resource. Personal care attendants provide personal care or supports for the waiver individual. The PCA is hired by the EOR to provide CD, personal assistant, respite services, or companion services. These services are authorized by DMAS or its designated service authorization agent. An attendant must be 18 years of age or older, have skills to perform services specified in the member's plan of care, have basic math, reading, and writing skills, have a valid Social Security number, and be authorized to work in the United States, and successfully pass background checks from the Virginia State Police and Virginia Department of Social Services. Both provide criminal and Child Protective Services central registry checks. This document is called a plan of care. It helps to identify the needs of each member. The plan of care may also be referred to as the service plan. Employers, please note, a copy of the plan of care or service plan must always remain in the home. Each personal care attendant and EOR signs an employment agreement when they enroll with the fiscal employer agent. The following information is included in this agreement. An attendant may not be the spouse of the individual receiving services. They may not be the parent or step-parent of a minor child receiving services, and they may not be the designated EOR directing care for the individual receiving services. The role of a service facilitator is to develop the service plan with the individual and the EOR. They provide the appropriate FEA forms to start the EOR process. They submit service authorization requests. They train the EOR on required employer tasks. They document services required by DMAS, and they assist the EOR with FEA paperwork. The SF cannot be the individual receiving services, the member's spouse, a parent or step-parent of a minor child receiving services, a personal care attendant for the member, the EOR, or the Community Services Board Support Coordinator. Each EOR member and attendant must be enrolled with a CD-FEA. Managed care members use CDCN, PPL, or Access based on the member's MCO enrollment. Fee-for-service members use CDCN as their FEA. The FEA performs payroll activities on behalf of the EOR. This allows the individual to use waiver funds to hire and pay attendants. The role of the FEA is to process EOR and attendant enrollment packets, manage attendant employment and tax documents, issue paychecks for eligible payroll submitted, complete criminal and central registry background checks, and issue W-2 statements. The fiscal agent pays attendants on behalf of the individual. The EOR is the employer. The Department of Social Services has several resources available to explain your role as mandated reporters. The website provides details about Child Protective Services information. Using this resource will help you further understand the differences between abuse, neglect, and exploitation. The Department of Aging and Rehabilitative Services is tasked with investigating all reports of adult or elder abuse, neglect, and exploitation. This website has a training on mandated reporting. DMAS would like to provide information to consumers and EORs, as well as attendants, about Medicaid fraud. Your participation is crucial in helping to report and prevent Medicaid fraud. It is your right and responsibility as a Medicaid member employee. The Virginia Medicaid Fraud Control Unit investigates and prosecutes fraud abuse occurrences for the entire Medicaid program. This includes the review of all activity in the Consumer Direction Program. The website listed provides details that define fraud and abuse. Fraud is the intentional deception or misrepresentation with knowledge that the information is false. Examples include billing for services that were not worked, billing for services at a higher rate, or deliberately misrepresenting services resulting in unnecessary costs and overpayment for services. Abuse means to treat a person with cruelty or violence, especially regularly or repeatedly, excessive or improper use of services or actions that are inconsistent with acceptable business or medical practice. Examples include charging in excess for services, providing for unnecessary services or when you are not physically with the member, billing for items or services that should not be paid for by Medicaid. This link includes an informative video used by one of the FEA vendors, Consumer Direct Care Network. This resource provides information about reporting, preventing, and examples of fraud. This is just one example of the fraud process. Please feel free to contact your employer or fiscal agent to discuss information about their fraud process. Fraud prevention is the responsibility of us all, no matter the program. Electronic visit verification. What is EVV? It is a technology-based system that electronically captures details of services provided by the attendant. It ensures members are receiving the support they require and services are billed accurately. As we discuss EVV in further detail, we will go through the following terms. EVV, or Electronic Visit Verification, FEA, Fiscal Employer Agent, MCO, Managed Care Organization, and IVR, Interactive Voice Response System. As a requirement of EVV, these items are currently captured by timesheets with the exception of location. The EVV system must verify the types of services performed, the individual receiving services, the individual providing the service, the date of service, the time the service begins and ends, and the location of service delivery. It captures the beginning and ending. We will now discuss the manual entry exceptions process. Attendants will be required to clock in prior to starting a shift and will be required to clock out at the end of each shift. Attendants who live with the member are exempt from EVV requirements. Live-in attendants may use the web portal for time entry. Attendants must use one of the methods below: smartphone or IVR system for those in areas with limited cell phone services. Attendants may not use the web portal to clock in and clock out for EVV unless using an approved manual entry exception. These manual entry exceptions include forgets to clock in and out, phone not working or didn't have the phone, app was not working, member had an emergency, did not have a phone or tablet, entered the wrong time, lives with the member, or the consumer attendant is a new enrollee and the enrollment documentation was incomplete. Live-in attendants may choose I live with the member as a manual exception. Manual entries will be monitored by DMAS and the MCOs. Continued non-compliance may lead to disenrollment from CD services. Attendants are required to clock in and out on the mobile application. EORs are required to approve time worked using one of the methods below: a smartphone application, IVR, or the web portal. Each fiscal employer agent has an EVV application attendants and EORs may use to submit and approve shifts worked. Both Access and CDCN use CellTrack. Public Partnerships LLC, or PPL, uses Time for Care. As a Medicaid member, you may be eligible to receive a free cell phone to assist with the transition to EVV. If you are enrolled with DMAS fee-for-service and not with an MCO, please see available resources below. Each program has its own criteria for smartphone resources. Members may contact these vendors to inquire about them. If you are enrolled with an MCO, please contact your MCO directly for more information. Paid sick leave. Some personal care attendants now qualify for paid sick leave benefits. Guidelines include the individual must be Medicaid and waiver eligible. Attendants earn 1 hour of sick leave for every 30 hours worked. Sick leave cannot result in an overtime payment. Sick leave will not be paid when employment is terminated. To be eligible for sick leave, a caregiver must work an average of 20 hours per week or 90 hours per month, and have all time worked approved by the employer no more than 20 days after the end of the quarter. If the caregiver meets the sick leave eligibility criteria, they will earn 1 hour of sick leave for every 30 hours worked. Any caregiver with unused sick leave at the end of the fiscal year may carry over up to 40 hours into the next fiscal year. Attendants may continue to use these hours during the eligibility process. An attendant cannot accrue more than 40 hours of sick leave per fiscal year. For additional sick leave information, please contact your fiscal employer agent, Customer Service Department. An attendant may accrue 40 hours of sick leave per fiscal year. Attendants must submit sick leave within 30 days of using it. If an attendant is inactive for 13 months, sick leave balances reset to zero if rehired. Patient pay may be withheld from sick leave payments. Additional information may be found on the DMAS website under the CD Services section located at this link. Here's an important reminder. Fiscal employer agents are required to verify attendants meet the eligibility requirements to continue earning sick leave hours for July 1st, 2022 to June 30th, 2023 fiscal year. Attendant proof of address requirement. Some personal care attendants have the same physical address as the Medicaid member. This is known as a live-in attendant. Program rules state that each live-in attendant must submit documentation that shows proof of their address. A few examples of proof of address include a U.S. driver's license, state ID, passport or passport card, a school ID, a voter registration card, or a utility bill. Newly enrolled attendants must provide proof of address during the onboarding process. Failure to submit the required information will cause a delay in the enrollment process until all paperwork is received. Attendants may contact their FEA for assistance on how to submit this information. For your convenience, we have provided links to the following resources: the DMAS website, the DMAS Consumer Directed Employer of Record Manual, the Department of Social Services Child Protective Services information, and the Department of Aging and Rehabilitative Services Adult Protective Services information. Here are some additional resources: the DMAS CD Attendant Help email box, the DMAS Electronic Visit Verification Help email box, and contact information for all three fiscal employer agents. Thank you for your continued work with DMAS Medicaid members.